today's sunny 95.
Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but were too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. This is episode number 564. Did you remember to fall back? It's welcome to the first day of going off daylight savings time. I thought it was great because I got an extra hour of sleep. Hey, the title of today's show is kind of a continuation of the last couple, where we've been talking about the various dental procedures that I perform and what is my brain saying to my hands while I'm doing it. And also, why does it matter? This is considered part 3. Okay, so before we get started, let me remind you, if you'd like to follow me on Twitter, it's at Dr. Kvitko. And if you'd please go to my office Facebook page and like us, that would be awesome. Also, all past episodes, complete with video, are available at thereasonswesmile.com, and we are streaming live on Facebook. Many of you know that we do a Dr. Kvitko's question of the day about 10 minutes from now, and you will have a chance to win free flowers from DeSantis Florist. If you want to pre-program that number into your phone, the number you'll be calling will be 614-459-9769. That'll be in about 10 minutes, okay? 614-459-9769. Okay, so we've covered a lot of ground over the last couple weeks, but today we are going to talk about what is my brain saying to my hand when I'm doing subepithelial connective tissue grafting. That'll be the first one. The other is when I am doing surgery to remove a fistula or treat a fistula. And then another one's going to be what is my brain saying to my hands when I'm trying to figure out whether a tooth is cracked or not. And so we're going to start with grafting. All right, so I don't know if a lot of you have had gingival grafts or gum grafts. It's amazing how much need there is out there. If you look in the mirror, you pull your lips down and see if you can find any exposed root. If you see root, that's not good. And in most cases, it has to be grafted because roots don't resist tooth decay very well. And if you let it continue, you'll basically unzip the root from the gum and the tooth can fall out. Okay, or at least need to be lost. Alright, so when you do a graft, and by the way, we used to do what was called free gingival grafts, not because they were free, but because we were freeing up the outer layer of the tissue, called the epithelium. And they didn't look as nice, didn't work as well, but it's all we had back then. And then probably 20 years ago, somebody came up with this subepithelial connective tissue version, where we remove the underlying tissue, not the outer coating, not the epithelium, but the underlying connective tissue. That's where the sub comes from. Okay, so we have two sites. We have the recipient site and we have the donor site. So the first thing I have to consider is when I'm preparing the recipient site, first thing I have to figure out is, am I going to use a person's own tissue, or am I going to use purchased tissue, which would be known as alloderm? Okay, now, your own tissue works better, and it leaves a more robust, if you will, plump result, looks more natural. But if you don't want to have a second surgical site, or if I'm trying to do maybe 12 teeth at a time, then we would want to use the alloderm, the donated tissue. The other is do I have enough blood supplied to the graft? So in order to make this work, there has to be plenty of blood flowing to that tissue while there is healing happening. And so the design of the flap that we're going to use is very important, because if we cut off the blood supply, you're not going to get any healing, and it might even look worse when we're finished. The other is the graft immobile? So once I take a piece of tissue and I attach it in the right spot over the root of the exposed tooth, Then I have to make sure that when you move your lip, when you move your tongue, when you chew, when you talk, that it's not going to move. Because if you want something to grow in a certain spot, you need to hold it in a certain spot. Okay? Now I'll tell you what, going back to the blood supply thing, that's very tricky because if you take and design a flap that has straight edges straight up, like it looks like a square, you're in good shape. If you have one that is designed to be more of a trapezoid, where it's more narrow at the top and wide at the base, where the blood supply is, that's even better. But if you have one that's an inverse, where it's narrow at the bottom where the blood is flowing and wide at the top, well, you've just cut off the blood supply to the wide part, the edges there. Okay, how many teeth can I do at a time? And I can figure out, I can do that mostly because I know how much tissue I can access between, say, the upper cuspid on the lingual side or the palatal side and the molar. I can't go very close to the first molar because there's a nerve there. And when I talk about keeping things in place is the graft immobile, well, one of the ways that I do that is sometimes I'm going to take the stitch and I stitch it through the grafted tissue, and then I attach it to the teeth on either side using composite resin, a little bit like the way we bond orthodontic brackets onto a tooth. And so I use these to create the tension and keep it stable. Sometimes I need them, sometimes I don't. So my brain is saying, which one are you going to do, Doc? You know? We can also use stitching techniques where we kind of run a stitch underneath the graft and kind of like pull up, almost like a sling. And that works in a lot of instances, but I do have to worry about if I put that sling and it's really buried, am I going to be able to get the stitches out down the road? And if I'm not sure I can, well, maybe I should be using Vicryl or gut, something that's going to dissolve on its own. Before I bring a graft tissue to a root, I want to make sure I've removed what's called the smear layer. It's all of that microscopic gunk that's on teeth. It's a little bit of food, a little bit of what's called Materia alba, some bacteria, and even some necrotic cementum. So I have to clean that all off and get it really, really super clean to make sure that there's a chance that this tissue can actually attach there. So when we do Dr. Kvitko's question of the day, you're going to find probably the three I'm going to highlight are going to be, do I have enough blood supply to the graft? Is the graft immobile? And have I removed all of the smear layer from the root of the tooth? Now, as I mentioned, grafting involves two things. There is the recipient site, which we've just spoken of, and then there is the donor site. So if we're using your own tissue, of course. So when I'm harvesting the tissue, my brain is saying, did you get enough? Did you make it a big enough incision, and did you grab enough tissue from under there to make this work? Did I get it too thick or too thin? Too thick is okay because I can shave it back. Too thin, a little tricky to do too thin, so I have to be really careful when I'm doing that. And I'll tell you what, harvesting the tissue off of the palate, and again, it's not off of the palate, it's underneath the outer layer of the palate. Keep that in mind. Then so I have to make sure it's not too thin. And there's, the palate is kind of curved up there, and it's a little bit hard. You've got the teeth in your way, you've got the lips. But getting it too thin is a big no-no. Then, once I grab the tissue, I pull it out with these tiny little gripping pliers. If there is a little bit of epithelium attached to it, sometimes there is, the top edge, just a little stripe, well then I have to get rid of that, because if I bury epithelium, under epithelium, I can create a cyst. So as I'm working, my brain is saying, did I get all the epithelium? Did you make sure you got it all? You don't want to have any under there. Okay, now, if I take my tissue, I harvest the donor site, and I put it in my my dish of saline, and I look at it, or I measure it. Well, let's say that I needed 12 millimeters, and I'm looking at it, and I only have 8. Okay? Now, sometimes I only have 8 because that's all there was available, but it's still not going to work if I need 12. So what I've come up with, and it works really well, is I'm able to take this section of tissue that might be 8 millimeters wide, and maybe it's 5 to 6 millimeters tall, and I will cut it, not all the way in half, but I'll slice up the middle, and then I'll turn that piece out, kind of like making a piece of paper longer. It's pretty neat. It's a pretty neat way of doing it. And then I'm still able to do what I need, and in some cases that gives me extra, more than I was actually going to need. But it has to be a consideration before you go to place it, because you can't just put a piece of tissue that's too narrow. Okay, now after I'm done with harvesting the tissue, then I have to be really careful to place stitches on the roof of the mouth in a way that it's not going to bother you, the way that their tongue's not going to play with it. There's nothing going to be raw exposed. I'm trying to create what's called primary closure, where the one cut edge comes right up to the other cut edge, and that's going to be the fastest and best healing, is if those two cut edges touch each other. So I'm checking on to make sure I do that. Now, when I'm harvesting the tissue, something that I also have to consider is, am I too close to the nerve? Remember I mentioned there's a nerve by the first molar on the palate, greater palatine, and if I take some of that, what's going to happen? You're going to have some temporary, or even worse, permanent numbness on the roof of your mouth by the back half of where I harvested that tissue, and we don't want that. So there's a lot of discussing going on between my brain and my hands as I'm doing this. In addition to that, in addition to everything I've said so far, what's also happening is I'm thinking to myself, or my brain is saying to me, is this person numb enough? Are they staying numb enough? Is there too much bleeding? Do I need to use pressure? Do I need to make sure that this is, that I have enough epinephrine, enough of the what am I trying to say? Anyway, the vasoconstrictor, yeah. And so there's a lot going on, and then I'm also thinking about you as a patient. Are you comfortable? Are you going to be comfortable at home? What drugs am I going to prescribe? All of that, all the while, as we work, we're smiling and saying, hey, you're doing great, because you are. Unless you're biting me, we would say you're doing great. And that's not happened. And I also go by people's the body language and is their forehead tightening up? Because sometimes people are feeling something, but they don't want to bother us. They want to be brave or just don't want to be a bother. And so I'm always making sure that a person is comfortable throughout the entire procedure. So anyway, gum grafting, that's a lot of discussing going on between my brain and my hands. But you know what? They come out awesome, and people come back and get others when they need it, and it's just a really neat service. So, as I mentioned, we do Dr. Kvitko's question of the day about now. You're going to have a chance to win flowers from DeSantis Florist. Before we do the contest, though, we'd like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
All right, and you're going to have a chance to win free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon. The question of the day is, while I'm doing gum graft surgery, what are some of the things that my brain might be saying to my hands? A, do I have the graft completely immobilized on the recipient's site? B, have I removed all of the smear layer from the surface of the tooth root? C, do I have enough of a blood supply through the grafted tissue? Or D, all of the above, all right? The number to call, 614-459-9769. 614-459-9769, so go ahead and call now.
You won't believe it though. I wanna hear your mind, and there's nothing else in the world tonight. She said, people don't take the time. Hey, people don't take the time.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko. Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard.
All right, we're back. We're doing Dr. Kvitko's question of the day. We have callers on the line. We actually flipped the coin to figure out who we would go with today, and it looks like it comes up Rose. Everything's coming up Rose. That would be number 2. Sorry about that to my producer. All right, Rose, are you on the phone?
Yes.
Okay, how are you? And do you have Dr. Kvitko's answer?
Yeah, D, all the above.
That's right. Hey, Rose, what do you do for a living?
I'm retired.
As a?
Human resource officer.
Human resource officer. Okay, cool. We are going to have you stay on the line so we can get the flowers, or know where to send the flowers, I'm sorry. They'll come from DeSantis Florist, and you'll get them on Tuesday afternoon, okay?
Awesome. Thank you.
You're very welcome, and thank you for listening. Okay, if you're just joining us, I'm Dr. Kvitko. This is episode number 564 of The Reasons We Smile with Dr. Kvitko. Today we are bringing you part 3 of During Various Dental Procedures I Perform, What is my brain saying to my hands and why does it matter? So now we're going to talk about fistulas. Now I did a whole show about fistulas, but I didn't tell you what my brain was saying to my hands when I did it. So a lot of these tend to be on the upper arch. I don't know if it's 60-40 or what. I think you could probably argue that they're 50-50, but it seems like the ones on the upper are more memorable because they tend to come around teeth that have had some kind of a trauma, and if somebody falls off their bicycle or when they're little and bang their tooth, those teeth can die over time, and so it just feels to me like a lot of these are upper in the front teeth. So when I see a big dark spot on the x-ray in the bone, I know that's an infection. I know there's probably granulation tissue in there. If the infection is trying to drain out the side of the gum, there's a little like bubble and there's pus kind of seeping out, then I know it's a fistula. But what I don't know, right away at least, is it located more to the lip side of your mouth or to the inside of your mouth? Meaning, is it buccal or lingual? Because if it's lingual, inside, well, I might need to approach it from inside, come from the palate to get at it. If it's buccal or out by the lip, I might make my incision up above your teeth. Then I have to worry about, does the fistula connect with the maxillary or nasal sinus? If so, how am I going to handle that? Because I've had several where by the time I find it, meaning by the time people come to me, or in some cases by the time somebody allows me to take an x-ray, which as you know is a big bugaboo of mine, I want to take x-rays to see what's going on, and people are like, well, my insurance won't cover that for another 3 years, and I'm looking at them like, really? That shouldn't matter, you know? But anyway, guess I won't get on that soapbox today. Maybe another day. Excuse me, but... Okay, and I actually have had one where the patient had 2 sinus surgeries because of sinus infections in the nasal sinus area. And then it kept coming back. So when it came back a second time before doing a 3rd surgery, the ENT said, you should go check with your dentist. And he did. And sure enough, it was a tooth. And so when I did the fistula removal, I knew I was into the nasal sinus, and what I had to do after doing all of the dental parts is I had to kind of rebuild the floor of the sinus. So what I did was I put the bone particles, the donor bone, up there, and then I took my what's called 6-month collagen, or RCM6, and placed it up below it to give there like a barrier for this bone to rest on. And then I put more bone in there to rebuild the facial bone, if you will, the maxilla. And then more collagen over the hole that I had to make, or rather the fistula had made, to get to that point. So the other question is always, how many teeth has it affected? How many teeth has this granulation or granuloma? How many teeth are affected? It usually starts with 1, but if it's not caught on time, then it will grow, and as it grows, it eats away at the tissue around it. And so if I open up into that and I don't physically see the nerve going into the end of the next tooth, I know that that one's been affected as well. It's just been eaten away. So now I have to do a root canal on 2 teeth. And then the next question is, once I remove the granulation tissue, Will the body be able to fill in the area with its own new bone, or do I need to place bone grafting material to help it? And more often than not, I do have to place bone grafting material to help it, because sometimes it's just too big, and if you don't help by adding bone, well, then you might get more granulation tissue, and there it might start all over again. The other concern is, do I retrograde fill, meaning when we go in there, we can see the end of the root. Some of these teeth have already had root canals, and so they're failing, or it wasn't sealed properly in the first place. It's hard to say. And so if I can cut off the end of that root at a 45-degree angle and we get down to good solid seal, inner seal, well, maybe I don't need to place a little silver filling in the tip of that root. Or if I can see that the end of that root, sometimes you can just tell. You look at the end of a root. Now remember, we've made an incision, we've pulled it up, it's all exposed now. You can see the whole end of the root, and it just looks funny. It's a different color. Looks like it's been eaten at. Even if it's not moth-eaten yet, it just looks different. So sometimes I know then, if I just cut that part off, I'm good. The body doesn't realize that the end of that root has been determined by the body to be a foreign object. But if I get that off, we should be fine. But more often than not, we wind up placing bone, but it is something that we have to think about. And then, do I put the filling in the end? I have to decide, is that something that is needed? And about 50-50. Let's say it's more like 60-40. We do wind up putting a little filling there, just so we can be absolutely certain that we have the seal that we need to keep it from coming back. Because after all, that's the challenge, is do we want it to make sure it heals, okay? So that's a lot of discussing, right? We had the, is it inside or out? Did it go into the sinus? How are we going to handle that? How many teeth are affected? You can't just go in and do the one, not notice the one next to it, because you're still going to have an infection up there. Will I have to put bone grafting material? Do I use donor bone that is we purchase, or like bovine bone, or do I use human? And to be honest, it doesn't really matter, but a lot of folks have a preference, so we always give them that. And so it's kind of a fun procedure, kind of bloody. People don't like seeing it, but you'd be amazed at how well it works and how much better people feel when it's over. All right, so looks like we're going to take a break here. And when we come back, we're going to talk about the discussion between my brain and my hands on cracked teeth. You're listening to The Reasons We Smile with Dr. Kvitko, episode number 564, and we'll be right back.
You can't take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, you're the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
We're back. I'm Dr. Kvitko. This is episode 564 of The Reasons We Smile. Thank you so much for joining me. It is our first day not being on daylight savings time, so hopefully you didn't forget to fall back, because it's an hour, probably, what does it say? An hour earlier than you think. Or it's an hour later than you think. Whatever. Just you should have moved your clock back. Okay. So, the last thing we're going to cover, as I mentioned, is cracked teeth, and what is my brain saying to my hand when I'm thinking about and working on a cracked tooth. So one is when I see a crack, am I looking at a crack that's through and through, or is it like more like a craze line in old glass. You've seen old glass in maybe centuries-old churches. You know, it's all cracked, but it's not through and through. And if that's the case in your tooth, it doesn't matter. You just watch it. Also, has the crack adversely affected the nerve of the tooth? And we don't really know that yet. Sometimes when people tell me they get a soreness in their tooth and it's kind of intermittent, what that tells me is one of the cusps of their tooth is actually physically moving a little bit or flexing. And you can tell by looking inside oftentimes once we get in there by taking the filling out. You can see this line where it's been flexing and it's about to break there, but we don't know that from the outside with the filling still in. I always wonder if I do a crown now, can I hold the tooth together and avoid the tooth from cracking completely? So a lot of times when I see these cracks and the person has no symptoms yet, I think, well, boy, we better put a crown on here. Now we're going to hold it together. Maybe we can prevent the future damage that comes with letting a tooth completely crack. Because you never know how it's going to crack. Is it going to crack down the middle? And if it does, it's going to need to be extracted. If it cracks at an angle and it doesn't go too far below the gum line, well then I can put a large filling known as a crown buildup, and I can put a crown on it and solve the issue in most cases. Sometimes even if it breaks at an angle, it's hard to, we can't go too far below the level of the bone and not have it become a gum disease issue, if you will, or a periodontal pocket. We have to make sure that it's cleansable, that you can actually care for the tooth, and that we're not just setting you up to have a tooth that's going to fail down the road, you know. And then these cracks, keep in mind, these cracks are pretty much invisible to an x-ray unless they happen to be lined up just right. So if you take a regular kitchen fork and look at it from the one side, you can see that there are 4 or 5 tines, and you can see space between each of the tines, right? But if you turn it the other way, it looks like just a solid piece of metal. Well, if the x-ray is lined up in the way that it's turned sideways and it looks like a solid piece of metal, well, you can have cracks in there and we wouldn't know it. And unfortunately, the way the cracks happen, it's usually that way, not the other way where you can see the tines. So, we have to wonder if there's a root canal tooth that is failing or never really took to begin with, especially if it looks excellent on the x-ray and we know we have the right length and we have a good seal, and yet the person still has discomfort. That tends to be, or at least you start thinking about, what if this tooth is cracked longitudinally all the way from top to bottom and you just can't see it. So there are a lot of what ifs that go on, a lot of discussing with my brain and my hands when I'm dealing with cracked teeth. I think it is the toughest thing for us to figure out, to diagnose, and just know that we get it, that we've gotten it right. And I'll tell you what, I don't think you ever really know with a cracked tooth until, in some cases, after you've extracted it. So anyway, I just thought that was an interesting one, and I bet you other dentists out there would agree that cracked teeth are the biggest bugaboo that we deal with. We do a pretty good job of figuring it out, but sometimes it takes a few tries, and I'll just tell the person, my patient, I'll say, hey, I need you, let's just wait, let's see if this gets worse, maybe we'll figure it out. I don't want to make the wrong mistake and take out a good tooth, and yet I don't want to do a root canal on a tooth that doesn't need it. And but on the other hand, I don't want you in pain because I didn't do something, you know? So it's really tricky. All right, so I'm getting that sign that I have just about a minute to close with my closing statements. Say that because it's political season. By the way, I voted 2 days ago, so I don't have to worry about it now. I don't have to listen to all of the politicians, and it's hard to watch television with all of those commercials. But oh well, what can you do? You know, hey, it's still the best country on the planet, despite all of our differences and all of our issues. If it weren't, we wouldn't have people wanting to come here by the thousands and millions. You know, it really is. So, all right, folks. Well, it's beginning to look like that is all the time I have. So, I'd like to let's just say, oh, here we go. No, yeah, I got everything in. Okay, that's all the time we have. Don't forget to follow me on Twitter. It's at Dr. Kvitko. Please visit my office Facebook page and like us. It's Dr. Kvitko and Associates. Remember that all past episodes, complete with video, are available at thereasonswesmile.com. Be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588, or send an email to speaking@thereasonswesmile.com.